Namaste, good morning, and welcome to Times Health Plus. I'm Dr. Sneha Rathi. I'm a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and give the best results to my patients through them. Today, we are going to discuss about one of the most important joints of the body, which is very commonly affected. And I'm sure many of you must be seeking for clarity on that particular joint. And that is nothing but our knee joints. So today we are going to discuss more on the knee joints. This session is going to be divided into three parts. The first part is going to cover something about the knee joint anatomy and how the cartilage health can be maintained. The second part is more about why knee strengthening and alignment is very, very important in the asanas. And the third part will comprise of a series of yogasanas which are going to be very beneficial for the knee joint. So I hope all of you are ready and excited for this. Let's get on to the first part, that is understanding about the knee joint anatomy and how can you actually maintain and improve the cartilage health. So our knee joint primarily comprises of two types of joints. There is one joint that is present between the thigh and the shin bone. This is the tibiofemoral joint. That is one of the joint that is formed between the thigh and the shin bone. And the other joint is between the kneecap and the thigh bone. That is nothing but the patellofemoral joint. Okay, so there are two types of joint within the knee. Now, it's very, very important to maintain the health of both of these joints. Besides this, there are many structures that are present in the knee joint. Okay, so in between the bones, there is a cartilage. Okay, commonly people call it like एक गद्दी होती है अपने घुटनों के बीच में. Okay, so that is what commonly people call it. So there is a cartilage. There are menisci. Okay, these are the structures which distribute the load. Okay, so pressure जो है वो equally distribute करता है knee joint के ऊपर. वो होते हैं menisci. There are ligaments, सॉफ्ट टिश्यू स्ट्रक्चर्स जो नी में एक्सेसिव मूवमेंट अवॉइड करने की कोशिश करते हैं, ज्यादा मूवमेंट अलाउ नहीं करते हैं. ओके, एक रेस्ट्रिक्ट करते हैं मूवमेंट को. दैट इज नथिंग बट द लिगामेंट्स. वो जो है आजू बाजू में होते हैं नी जॉइंट के, एंड विद इन द नी जॉइंट अंदर की तरफ भी होते हैं लिगामेंट्स. ओके, सो देयर आर सम लिगामेंट्स व्हिच आर प्रेजेंट एट बोथ द साइड्स ऑफ द नी जॉइंट्स एज वेल एज विद इन द नी जॉइंट, so that your knee joint doesn't go in excessive motion. Okay, so it restricts that particular movement. Okay, and besides that, there is also the muscles which are supporting the knee joint. Okay, so there are muscles which are in front of the thigh, back of the thigh, also the hip and ankle influences the knee joint. Okay, so these are all the structures which are present at the knee joint. It is very, very important to maintain the health of these structures. Okay, so if there is any kind of ligament injury or there is a muscle tear or something like that that is happening at the knee joint, it is very, very important to go with the advice of the doctor, because it needs proper healing and a proper rehabilitation. So if you have understood that there is some ligament tear within the knee joint, or you have gone through a trauma which has led to ligament tear, etc., it is very important that you work according to the advice of your doctor and follow the rehabilitation properly, because it needs a systematic approach to be rehabilitated. But otherwise, how to take care of your knee joint? So I would like to give you a few tips on that. Okay, there are certain things that you can remember while caring for your knee joint. The first thing is you need to have an active lifestyle. Okay, active lifestyle means that you need to give active movement to the knee. For example, our knee comprises of a movement wherein you are straightening the leg and your knee can bend off up to approximately 140 degrees. Okay, this kind of movement is present at the knee. It is very important to subject the knee to this movement. इतना मूवमेंट हमारे नी में नॉर्मली होता है, ठीक है, अबाउट 140 डिग्रीज. आपको अपने घुटने को हर एंगल पे डालने की जरूरत है रोजमर्रे में. ओके, सो हर एंगल पे आपका नी बेंड होना चाहिए. इट इज वेरी, वेरी इंपॉर्टेंट, सो दैट ये एक तरीका है अपने नी जॉइंट के लिए केयर करने का. क्योंकि जो happens is that the cartilage is supplied by blood supply. Okay, not direct blood supply, but it is dependent upon these kind of forces at the knee joint. Okay, so when the knee joint is subjected to these kind of forces like bending the knee, straightening the knee, putting the knee into different angles, okay, then the cartilage is supplied by an adequate amount of blood supply. So you understand क्यों इतना जरूरी है अपने घुटने को अलग अलग एंगल्स पे डालना. Okay, it's very very important that you put your knee joints through different angles. That will help in a good blood supply to the cartilage which is present between the two bones. Okay, and it will maintain a good health of the cartilage. The second point is, besides this, it is very important to have proper weight management. By saying that, what I'm trying to say is, if your weight is on the higher side, that means the body weight is on the higher side, what happens is there is a lot of pressure at the knee joints because of the weight. In that case, you need to have an equal amount of muscle strengthening so that that weight can be taken by the muscles around the joint. You understand? Okay, so when the weight is more, your muscle strength also should be more. If that is not the case, then weight can be detrimental to your knee health. Okay, अगर वजन ज्यादा है तो घुटने की स्ट्रेंथ भी ज्यादा होनी चाहिए. अगर वैसा नहीं होता है तो घुटने पे उसका असर बुरा होगा. तो इसलिए weight management becomes very very important whenever you are taking care of the knee. So now, to have a proper weight, of course you need a good diet and lifestyle. Okay, so that's the next point of taking care of the knee joint, that is having a good diet and lifestyle. So having a good diet can supply the adequate amount of nutrition that is required to preserve these structures. So that is why you need to have a good diet. And lifestyle is very, very important. For example, incorporating walking in your daily lifestyle is a very good way of maintaining knee health. So make sure that you walk every day and try to walk more mindfully. Okay, so that is another thing that is very, very important. You can also incorporate stair climbing as it helps in strengthening the knee joint. So that is another activity that is going to help in improving your knee health. All right, so this was the next step. And the last one is to have adequate sleep. Sleep is one of the most underrated healer that we know. So it is very, very important to have a good sleep because all the healing or restorative processes takes place mostly when we are asleep. So having a good sleep becomes very, very important for any of your joint health, any of the muscular complaints that you have, because it relaxes the joint and helps in the healing process. Okay, so this is why it is very important first to have an active lifestyle, to put your knee through different movements, through different angles, to hold your knee at different angles. For that, we have many asanas that we are going to go through. Okay. Second, it is very important to have a proper weight management. Third, it is very, very important that you make sure to have a good diet and lifestyle. And the fourth is adequate rest or sleep is very, very important. Okay. Now let's discuss what are the detrimental things for the knee health. Okay, so I'm just going to quickly tell you what are the things that can actually, worsen the knee health. So as I said, of course, excessive weight can actually cause a lot of problem to the knees. Okay, then next is, of course, not having a good nutrition has a very bad effect on the soft tissue structures around the knee joint. Sometimes naturally we have a wrong alignment of the knees. Okay, that is naturally present, like bow legs or knock knees. Okay, in that case you have to make sure that you are maintaining knee health more rigorously than what normal people need to do. Okay, so if you have bow legs or knock knees, you need to make sure that you are maintaining your knee health properly. All right. And the last one is doing high impact activities without adequate training. So I have heard many people, they start running, skipping, jumping, okay, without having a normal exercise protocol in their daily life. It is very, very important that whenever you are planning any high impact activity, you make sure that you are exercising your knee joint enough. Okay, so when you are exercising and maintaining the knee strength and endurance, then you can plan a high impact activity. It is no problem to do a high impact activity. But if you are not doing adequate exercise, you're not maintaining the knee health on a regular basis, directly jumping onto a high impact activity can be very deteriorating. Okay, so it is not good to do a high impact activity without adequate training. Of course, if you're suffering from any condition like knee osteoarthritis, high impact activities are going to be not good for the knee joint. So it is important to avoid any high impact activity if you are suffering from knee osteoarthritis. But otherwise, if you are with the healthy knees, you can plan a high impact activity, but with adequate training. All right, so this was a little about knee joint anatomy and cartilage health. Now let's understand the next part of the session. That is, why is knee strengthening, okay, and knee alignment so important whenever we do any asana? Okay, generally when we do any asana, we try to achieve the final pose. Okay, but in that process, we sometimes just forget what is the alignment of the knee, what exactly is happening at different joints. Okay, this kind of unawareness while doing any asana can lead to any kind of injury to the joint, or it can be detrimental to the knee head. So it is very important to have the correct alignment whenever you are performing any asana. Okay, so let's understand why knee strengthening is so important. Before that, if there are any questions, I would like to take them. So I think there are no questions, but good morning, Sarika ji, Wahida ji, Amitabh ji, Kavita ji, Abhay ji, Anita ji, Lakshmanan ji. Good morning, everybody. I'm happy you have joined. So now let's understand the next part of the session, that is, why is knee strengthening so important? Okay, so we have some muscles around the knee joint. Major, I think all of you must be knowing the main muscles, the key muscles, which are very, very important. One is the quadriceps muscle, which is in front of the thigh. There is the hamstring muscles, which is at the back of the thigh. Okay, and then there are some small local muscles which are also present around the knee joints. Also, the hip joint flexibility and strength influences the knee joint. The ankle joint flexibility and strength influences the knee joint. Your core strength also influences the knee joint. So whenever you are doing any practice, you have to make sure that you're training all of these along with the knee joint, even if your target is to make the knee joint better. Okay. So now what happens is, whenever your body weight comes on the knee joint, okay, what happens is, if there is inadequate muscle strength, the two bones will come closer to each other because of the weight of the body and the joint reaction force that is coming from the ground. So it is very important to have adequate strength of the muscles, so that whatever weight of the body is coming on the knee joint is distributed between the two. It's not just going onto the joint, but it is shared by the muscles. Okay, whenever you stamp on the ground, that shock that comes from the ground is absorbed by these muscles. Okay, so it is very, very important that you strengthen your muscles. By strengthening your muscles, you're actually going to protect your knee joint from any kind of injury. You're going to actually prevent any kind of strain while performing any asana. You're going to actually improve the movements at the knee joint. Okay, so it is very, very important that you strengthen your muscles and also stretch them adequately. So a balance between stretching and strengthening is what is needed. The next thing that is very, very important is the alignment while doing any kind of asana. So whenever you're putting your knee joint through any asana, okay, what happens is, at what angle your knee is placed will influence the stress on the knee joint. Okay, so when I say that, for example, I'll give you a simple example of Padmasana. Okay, so whenever we put our knee into Padmasana like this, okay, if you are not having adequate flexibility at the hip, okay, and you are still forcing the knee into Padmasana, there will be excessive movement taking place at the knee, and that can cause pain or injury to the knee joint. So you realize how flexibility of the hip can actually influence the knee joint. So I'm repeating this again. जब हम पद्मासन करते हैं, अगर आपके हिप में उतनी फ्लेक्सिबिलिटी ना हो, ओके अगर वो मूव नहीं कर पा रहा है उतना, तो क्या होगा कि नी से ज्यादा मूवमेंट कॉम्पेंसेट होगा, नी से ज्यादा मूवमेंट होने की कोशिश होगी, बिकॉज आपको वो एक्टिविटी कंप्लीट करनी है, तो वो नी से ज्यादा मूवमेंट करने की कोशिश करेगा और उसके वजह से नी जॉइंट में पेन होने लगेगा. And your complaint would be that I have pain in the knee joint. Okay, but actually what is the problem? The problem is restriction at the hip joint. Okay, so you understand how important is alignment, flexibility, strength whenever we are practicing any kind of asanas at the for the knee joint. So this is why I'm going to continuously tell you about alignment whenever we are doing the asanas. That is the next part of the session. When we are performing all of these asanas, I'm going to continuously tell you what alignment is required, what is the muscle work required, okay, so that you have more knowledge on that. But I hope you can understand why I'm talking so much about alignment. So if your knee is put into awkward positions, it is going to be more prone to injury, which we don't want. We want benefits from yoga asanas. So that is why it is very important to put your knee in proper alignment whenever you're doing any yoga asana. All right. So now we're going to progress to the next part of the session where I'm going to show you a series of asanas, okay, which are supposed to be done, which are going to be beneficial for the knee joint. Of course, if you have got any kind of injury to the ligaments, if you have got any kind of surgery done to the knee joint, okay, or you have knee osteoarthritis, you are supposed to be very cautious with any of the asanas, and it is always better and it is always advisable to go as per your doctor and your physiotherapist, to go as per the protocol they have set for you. But if you have healthy knees, these asanas are going to help you a lot in maintaining the health of the knee joint. Okay, so now we are going to stand up on our mats and we are going to perform the asanas. So yeah, good morning Rahul ji, good morning Param ji. Rahul ji says, I have been injured while playing and my right knee got badly injured. With the overuse of my left leg while cycling and climbing stairs, my left knee also started paining. So yeah, Rahul ji, you need to get, if your right knee was badly injured, you definitely need to get it evaluated properly by a doctor as to what kind of injury has happened. Okay, and it is very common that when one of our knee is paining, we tend to weight bear more on the other knee, and that also starts hurting because of that. Okay, so it's very important to fix the injury that you have got and get rid of the pain and the symptoms that you have, so that you can weight bear equally on both the legs. All right, Chandan ji, good morning. I am facing ligament problem. What type of knee exercises could suggest, please? And which exercises should we avoid, please? So, Chandan ji, generally ligament injuries, you have to be very specific with the exercises. So, I need to know what ligament injury you have got in order to prescribe any kind of exercises. If you have got ACL, there will be different set of exercises. If you have got PCL, there will be different set of exercises. If you've got meniscus, there will be different. So I need to know which ligament is injured. So it is always better to consult with the physiotherapist in person, so that they can evaluate your knee and then suggest some exercises. Some basic exercises I'm going to suggest in this session, but it is always better and advisable to go to a professional and then get yourself prescribed for the same. So let's start with a knee joint flow. So now we are going to first start with conditioning practice, that is Sthit Prarthanasana. So we are going to keep our legs together. I would invite all of you to join in with your mats and stand with your feet together. Look at one point in front of you. Chin parallel to the ground, back as erect as possible. Now slowly join your hands in front of your chest. When you're ready, you can close your eyes. But if you have balance issues, you can keep your eyes open and also keep some distance between your feet. Now just try to observe your body and your breath. Try to bring all your attention towards your body and your breath. Pay attention to each of the joints and muscles of your body. Try to get all your attention towards your body. Slowly relax and release. You can open your eyes and release your hands. Now, take 1 foot distance between your feet, and we are going to start with the warm up. As I always say, warm up is very, very important. So, we are going to start with first the neck movements. So, take your neck up and down. One, up, down. Two, up, down. Three, up, down. Four, up, down. Five. Okay, so around 5 to 7 times of each movement. Now we're going to rotate our neck. So turn your neck towards the right and left, right, two, left, right, three, left, four, and five. Now drop your neck towards either side. So towards the right, ear to the shoulder, left, one, two, three, four, five. Perfect. Okay, now keep your hands on the shoulders and turn your hands up. One, round, two, three, four, as big circles as possible. Five. Now back to the front. One, two, three, four, five. Okay, now wrist rotation. So just turn your wrist. One, two, three, four, five. Other way around. One, two, three, four, five. Okay, next we are going to turn our body. So rotate at the spine a little bit. So just join, interlock your hands in front of you and turn towards either sides. One, two, three, four, five. Mind you, when we are doing this exercise, we are also causing a slight rotation component at the knees, which has to be really controlled and it shouldn't be sudden, okay, so that your knee gets injured. No, we don't want that. So a rotation component at the knee, but a very controlled movement, okay. So this is very, very important. Next, we are going to go for the hip movement. So we are going to lift the hip up one by one. One, you can keep your hands on your waist. Two, three, four, five. Okay, now a simple exercise for the knee joint. Okay, very beneficial for anybody. okay, would be just bending the knee against gravity. So as much as possible, 1, 2, 3, 4, 5. If you have knee pain, you can always take support of the wall or the chair. Okay, that is advisable. So because you're standing on one leg, so you need support. Okay, in that case, you can easily take support of a chair or the wall. Other side, 1, 2, 3, 4, 5. Okay, now we are going to rotate the ankle. Okay, so mobility for the ankle, 1, 2, 3, 4, 5. And the other way around, 1, 2, 3, 4, 5. Okay, the other side, 1, 2, 3, 4, 5. Other way around, 1, 2, 3, 4, 5. Okay, so our main aim that is going to be there through these asanas is to improve the gyan bhav. Okay, so what we are always told is that there is something called as the gyan bhav, or the body awareness that we have generally when any of these conditions like knee osteoarthritis or any orthopedic problems, generally that is what we lose, the body awareness. So where is your knee placed? Okay, that is very very important, at what angle it is, to understand that without even looking at it. Okay, that sense of the body should be really strong. If that is really strong, then generally you won't end up with any kind of injuries or any kind of degenerative conditions, okay, or orthopedic problem. So improving the gyan bhav is very very important, or the body awareness of what, where or how the knee joint is placed. Okay, so let's start with that. So first asana is talasana, wherein we are going to take a 1 foot distance. Okay, we are going to do talasana 3. So we're going to come up on our toes. Inhaling, raise your hands up from the side. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so over here it is very important you don't hyperextend your knees, don't push them too much behind. Okay, keep them normal, soft, okay, and straight. That's all. Okay, we're going to repeat this 2 more times. So let's start. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Repeat it once again. So let's start. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right, so this was about talasana. Very beneficial because it's going to strengthen your calf muscles as well as the entire posterior chain, in fact. Okay, your glutes, calves, everything. So it's going to be very beneficial for the knee joints. Okay, so now let's see the next asana, that is Utkatasana. Okay, not recommended for anybody who has acute pain, or if you have knee osteoarthritis, I will suggest some modification for the same. Okay, but we are going to do Utkatasana with healthy knees. Okay, so what we are going to do is 1 foot distance between our feet. Going to take our hands up, come up on our toes. Slowly squat down as far as possible. Stay there. 1, 2, 3, 4, 5, 6. Come back up. 1, 2, 3. Stay there. 1, 2, 3, 4, 5, 6. 1, 2, 3. Very important that you, whenever you're doing a squat, you do not lean forward. Okay, this is the most common mistake in alignment that is done, is when they're doing a squat, they go like this. Okay, what happens with this is there is a lot of shift of center of gravity towards the knees, and the knees may actually start hurting. Okay, so if this is the case, it is very important that you first strengthen your core, strengthen your knee muscles, and then attempt this asana. Or you can modify with a wall support, which I'm going to tell you next. But let's do Utkatasana once again to understand it better. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Okay, very beneficial because it's going to strengthen quadriceps, it's going to strengthen the glutes, it's going to strengthen the core. Okay, if in case you're not able to go down as much, it's okay. You can go as much as possible and try to stay there. Okay, and gradually every day when you practice, try to push yourself 5% extra. Okay, a little more than what you can go. Slowly and steadily you will reach till in a proper squat. Another thing is, when you are doing this squat, make sure you're not flaring your knees out. Okay, so you are keeping your knees parallel and straight. Okay, so let's do it once again. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Okay, so this was Utkatasana. A modification of it would be to go towards the wall. Place your back against the wall. Keep your feet a little forward. Okay, and just squat like that. So this is going to train you to keep your back straight, neck straight. Okay, and then just use your thigh muscles and the glutes in order to perform this particular asana. Okay, so what you're going to do is you're going to slide yourself down against the wall with the back straight. Stay there for 1, 2, 3, 4, 5, 6, and then push yourself up again. Okay, so this way you can modify the squat and practice it. Okay, that's going to help you in keeping the correct alignment. Now, what is the correct alignment is, when you are squatting, your knee should be pointing towards the second toe, not too much outside, not too much inside, but the second toe of your foot is the right measure of telling you whether your knee is properly aligned or no. Okay, so many a times I have seen people doing this, okay, while squatting, or flaring their knees too much out. In this case, what happens is, when you're trying to do this, it's going to strain the inner part of the knee a lot. Or if you're doing this, it's going to strain the outer part of the knee a lot. We don't want any unequal imbalances at the knee joint. So it is very important to keep it correctly aligned whenever you're doing a squat. So this was about Utkatasana and squat mechanics a little bit. Now we're going to do Veerbhadrasana 1, okay, wherein it's kind of a lunge position. So we are going to take 3.5 to 4 foot distance between our feet. Okay, turn the other foot about 45 degrees in. Slowly turn your body towards the knee. And now lunge forward or bend your one knee. Slowly raise your hands up and join them up and stay there. 1, 2, 3, 4, 5, 6, and come back. 1, 2, 3. Okay, now we will do it on the other side, same thing. So turn one foot to 90 degrees outside, the other foot is about 45 degrees inside. Turn your body towards the 90-degree outside leg. Okay, now slowly lunge and take your hands up. 1, 2, 3, 4, 5, 6. Come back. 1, 2, 3. Now, generally, what happens in this, people tell that your knee should go up to, it should be behind the ankle. Okay, so that's absolutely right. Because if you try to do that, you need to have a really good knee health. In that case, you can do that. Okay, but if at all you have some doubts, it's always better to go for a position which is the knee is behind the ankle. Okay, now the other thing that is very, very important over here is not to lean forward while doing this pose, and which is why I guess they have added this component of raising the hands up, because it's going to keep your pelvis aligned over the hip and the knee. Okay, so it's very important to keep your pelvis aligned. If you do it like this, then there is proper activation of the quadriceps, of the glutes. Okay, and there is a proper muscle work that is being done. So let's repeat this with breathing and counts. Yeah. Okay, so again, 90-degree outside, 45 degrees inside the other leg. Turn your body. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Repeat it on the other side. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right. So this was about Veerbhadrasana 1. A very good exercise because you're putting the knee into 90-degree position, which is a very optimal position for improving the strength of the quadriceps. Okay. Now we're going to do Veerbhadrasana 2, which is slightly in a different direction as compared to what we just did. Okay. This was forward lunge. Veerbhadrasana 2 is like a side lunge. Okay. So we are going to do 3.5 foot distance between our feet. Again, turn one foot outside. Take your hands at shoulder level. And now the knee is pointing towards the side when we are bending it. Okay, so you go like that. Stay there. 1, 2, 3, 4, 5, 6. And up. 1, 2, 3. Okay, turn it to the other side. 1, 2, 3. Stay there. 1, 2, 3, 4, 5, 6. And up. 1, 2, 3. And relax. Again, over here, generally I have seen when people do it, so they tend to lean towards the same leg. Okay, that leaning shouldn't happen. Instead, you should keep your upper body absolutely aligned and try to move exclusively from the hip and the knee. Okay, so let's do it with breathing now. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Look at your right hand. 1, 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Turn your left foot out. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. All right, so this was Veerbhadrasana 2. We will repeat this once again because I'm going to give you a challenge related to this later. So please understand this asana well. Okay, so turn your right foot outside. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Turn your left foot outside. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. So you get it? Such an important asana wherein you are placing your knee into a lateral position. You're also having the other knee stabilize the position. Okay, so you're doing a lot of muscle work in this asana. It's going to be very beneficial for your legs, entire lower limb mechanics. Okay, so this was Veerbhadrasana 2. Next, we are going to go for Natarajasana, which is a one leg standing asana. So it's very important that you take support because it needs a good balancing. In Natarajasana, what happens is we are actually stretching the quadriceps muscle. So throughout the day, we are standing. Throughout the day, we are into different motions. Okay. So what happens is this quadriceps might go into tightness. It's very important to give it mobility. So Natarajasana is very beneficial for it. What we are going to do is we are going to bend one knee, hold the ankle, and slowly lift it up from behind. Stay there. 1, 2, 3, 4, 5, 6. And 1, 2, 3. Okay, so over here what happens is you are stretching the quadriceps. You're giving the hip a little bit of extension. Okay, you're also opening the knee. Okay, we're going to do it on the other side. Hold the ankle. Stay there. 1, 2, 3, 4, 5, 6. And 1, 2, 3. Okay, so this. Now we can do this with support as well. So you can use a chair and what you can do is this will be a little more better and localized version for the knee. So you can hold the chair, okay? Make sure the chair is sturdy and not very light in weight, otherwise you might lose balance. So hold the chair, hold your ankle, and now try to push your ankle against your hand and try to extend your hip as much as possible. Okay, stay there. 1, 2, 3, 4, 5, 6, and back. So I'm slightly leaning forward, okay, but not too much. And there is also movement at the hip. Okay, now let's do it on the other side. Bend your knee, slowly push behind, stay there. 1, 2, 3, 4, 5, 6, and slowly down. Okay, now what is the common mistake that is done in this asana is generally people tend to flare their knee outside just to achieve the movement, because if you flare the knee outside you will be able to move more. So that shouldn't be the case. You need to make sure that you're going straight behind and up, okay, and not trying to push it out. Straight behind and up. Okay, so this is about Nataraj asana. Now, a few simple exercises for those of you who are asking me something for the knee pain. Okay, so these are very general exercises which you can do it on the chair. So you need to sit with your back straight. Make sure you are keeping your back unsupported and straight. And now what you are supposed to do is supposed to extend the knee as much as possible. Okay, but what happens when we do this is I see many people, they go like that. Okay, like compensating at the lumbar spine. That shouldn't happen. You need to make sure that your back is erect and then you straighten the knee. There will be an adequate amount of stress over here. Hold the position. 1, 2, 3, 4, 5, and relax. Same way. 1, 2, 3, 4, 5, and relax. Okay, so a good amount of stress on the quadriceps, but not doing this. This is not the right way to do it. Okay, you need to keep your back straight. So this is one of the exercises. The other one is for the hamstring. So what you can do is you can come forward in the chair and slowly bend your knee as much as possible. Okay, bend your knee as much as possible. This is another way to strengthen a little bit of your hamstrings. Okay, and hold the position. 1, 2, 3, 4, 5. Relax. 1, 2, 3, 4, 5. Relax. All right, so this was about some simple exercises for knee pain, okay, which you can do. Next, we are going to do some asanas which are in sitting position. So you can sit on the mat. Okay, before going to that, I might take a few questions. So Suchita ji says, I play badminton and my knees sore for a day and heals in a couple of days. So Suchita ji, you can, for the soreness of the muscles after a sport, icing really helps to relieve that soreness really quick. But you also need to build some endurance in your muscles so that eventually the soreness gets a little more delayed in onset. Okay, so it shouldn't come very early. It should slowly and steadily become more later in onset. Okay, so you need to improve the endurance, which means you need to repeat the exercises more often. Okay, that's going to actually help in improving that soreness that onsets after the play. Ranajit ji says, I have been suffering from ligament injury since 2021. Please suggest some specific exercises for ligament injury. So as I said, sir, it's very important to know which ligament is injured, because exercises have to be very specific related to any particular ligament. Okay, so I cannot just suggest some general exercises, but you need to be very specific with what ligament is injured, and those type of exercises are required. Okay. Kiranji says, suggest some exercises for varicose veins. Yes, sure, Kiranji. We will be going through that as well in the coming session. So stay tuned with these sessions. Okay, Chandanji says, feel knee pain while standing continuously. If you advise any exercises which help me recover with that pain, please. So knee pain with standing continuously. So if you're standing in a constant one position for like a very long time, it's going to fatigue the muscles, and that's going to obviously cause knee pain. It's very important that you keep changing the position while standing, shifting weight on one leg and then on the other, maybe bending your knee eventually. Okay, and work on strengthening of your muscles. Okay, so if you work on the strengthening of your muscles, once the strength increases, then the load on the knee joint would reduce even in standing. Okay, so that is going to actually help you with reducing the pain in standing. All right, so now next we are going to do some simple exercises and asanas for the knee. So one is static quadriceps exercise, which I have showed in the previous video as well. You just need to press your knee down and contract your muscle over here. That is 1, 2, 3, 4, 5, and relax. A very effective exercise for handling knee pain. 1, 2, 3, 4, 5. Relax. Okay, so I hope you can see the muscle contraction. 1, 2, 3, 4, 5. Okay, so this is static quadriceps, very commonly done. Next is we are going to do something for the mobility of the knee. So bend the knee, sitting Pavan Muktasana like that. Keep your back straight and hold the position. 1, 2, 3, 4, 5, 6, and relax. The other side. 1, 2, 3, 4, 5, 6, and relax. So in this, it's very important that you move the knee as much as possible first on your own. Don't try to grab the knee from here itself. Try to move the knee as much as possible on your own. Okay, and then straighten. 1, 2, 3, 4, 5, 6, and relax. And the other side. 1, 2, 3, 4, 5, 6, and relax. So this is nothing but sitting Pavan Muktasana. Next, we are going to go for Vajrasana. Okay, very beneficial again for the knee, but not for those who are suffering from knee osteoarthritis or ligament injury or any surgery. Okay, so what you're going to do is sit in Dandasana position, turn your knees inwards, and sit in the cup that is made from the heels. So you keep your toes together and heels apart. I'll show you. So it is like this. And you sit like that with your back straight. Stay in this position with normal breathing. And relax and release. So you can stay in this position for about 30 seconds also. Okay, so but improve the timing gradually. Okay, don't try to go for it in one go. Try to slowly build up on the sitting on the in Vajrasana position. You can always sit in Vajrasana after you have had your meals. That's also going to aid in your digestion as well as help in our knee health. Okay, because we are putting the knee into extreme flexion position, which is required on a daily basis. Okay, now let's see some asanas in lying down position. Okay, so we are going to turn on our side and lying down. So the first asana is Setu Bandhasana. Again, good for your knees, but only if you do it by, putting adequate pressure on your feet and your legs. Okay, so keep your hands beside. Inhale and lift your hips up. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, we will repeat it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so this is a good work for the glutes, for the back, and it's also going to, recruit some of your quads and the hamstrings. Okay, so we will repeat this again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, the next one is a simple exercise wherein you keep your one leg straight. It's a straight leg raise. One leg is bent and you lift your leg straight up. And 1, 2, 3, 4, 5, and down. So you're going to keep it at different angles also. You can maintain it at 30 degrees. Hold 1, 2, 3, 4, 5, down. You can maintain it at 45 degrees. 1, 2, 3, 4, 5. So at different angles, you can train your leg to take the weight. Okay, so you can strengthen your muscles at different angles. Same thing, repeat it on the other side. 1, 2, 3, 4, 5. Down, lift it up. 1, 2, 3, 4, 5. Down and still higher. 1, 2, 3, 4, 5. Down. Okay, so this was straight leg raise. Now we are going to go on our abdomen and do Shalabhasan. Okay, so again, very beneficial for the knee as well as for the hip. Keep your chin down on the ground. Keep your hands beside your body. Lift your leg up straight, one at a time. Stay there. One, two, three, four, five, six. And down. Lift the other leg up. One, two, three, four, five, six. And down. Make sure you're keeping your knees straight as much as possible. Repeat it again. One, two, three, four, five, six. And down. The other side. One, two, three, four, five, six. Down. Also, I have seen many times people tend to lift their head a little up, which shouldn't happen when you're doing this. Your chin should be in contact with the ground. Okay, we'll repeat this one last time. One, two, three, four, five, six. Down. One, two, three, four, five, six. Down. Okay, and one last exercise is bending the knee and straightening it, bending the knee and straightening it. Okay, a very simple exercise, but it's going to maintain the mobility of your knee and maintain its health. Okay, now we do a little bit of relaxation practice. Okay, very good. So, for to end the session with, so you keep your knees bent, feet apart, knees together, one hand just below the rib cage, other hand is by the side. Now slowly inhale and exhale. As you inhale, your abdomen should rise up, and as you exhale, your abdomen should go down. This is Yogendra Pranayam number 4. So let's do it with 3 counts inhale and 3 counts exhale. 5 rounds. Inhale. 1, 2, 3. Exhale. 1, 2, 3. 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 Relax and normal breathing. Slowly you can turn on one side and get up. Okay, so these were a few asanas that I wanted to tell you. Okay, some of the alignments I have tried to explain as much as possible. Okay, so some few asanas which are going to be beneficial for the knee. There are many more asanas that are actually beneficial for the knee. Something, for example, the Bhadrasana. Okay, simple Sukhasana. Okay, so these are also very beneficial for the knee, but I couldn't cover all of it in one session. So that is why some of the important asanas I have tried to cover. All right, we have a challenge for you today. That is, you need to do Veerbhadrasana 2, okay, and hold it for 10 seconds on each side. Practice it daily. Click a picture of it or take a video of it and tag Times Health Plus, upload it on Instagram and tag Times Health Plus. Okay. Also, do follow Times Health Plus on their YouTube and Instagram channels and encourage others to do that as well, so that they can get the benefits of these sessions that we are taking. All right, so these were some of the aspects that I tried to cover. Okay, Suchita ji says standing hurts my back. Okay, so Suchita ji, I think you need to refer to the back sessions that I have taken. Try to look at them, and maybe that can help you a little bit on how you can strengthen your back, etc. Ajay ji says your speed is fast. Please give time to take notes. All right, Ajay ji, I'll keep this in mind for the next time. Paramji says, what is the general precaution in doing exercise if knee pain is there? So if the knee pain is very acute, okay, that means it's very painful and it is only 2 days past that you have got knee pain, it is always better to rest. Okay. If the knee pain has been a little subacute, you can probably go for the lying down asanas first. Okay. Get that control first and then slowly move on to sitting and standing asanas. Okay, and make sure you find out what is the cause of knee pain and address it properly. That is very, very important. Okay, Nidhi says, along with varicose veins, please add weight loss asanas and exercise. Sure, Nidhi ji. Chandan ji, can we increase or decrease the count as per our capacity or keep it as 3 and 6, which you are showing right now? Chandan ji, you can definitely increase the count. In fact, you can hold the asana for 30 seconds to 1 minute as well, okay, as per your capacity. But make sure that you're judging your capacity right. Okay, these are safe practices for everybody, and it's called the Yogendra rhythm, which is very beneficial. So, which is why I'm showing this dynamic form of asanas that we are doing. If you're going for a greater count, it is called a static holding of asanas. So, both have different effects. Okay, so you can always practice 363 as well as you can practice something which is for a longer hold time also. Both serve a little different purpose altogether. All right. So this was it for today. I hope I have added on to your knowledge on the different knee care aspects that you need to, take care. So I hope to see you next time with some more information on other joints. Till then, stay gentle, take care of yourself, and keep moving gently and slowly. Thank you and namaste.